Thanks everyone for being here. Cases are very high and continue to go up. I don't know if we've had the most recent update from the state yet as far as those numbers go, but we anticipate them continuing to rise. And as folks have been seeing, we're doing many things in partnership with the state and other nonprofit organizations, New Haven Public Schools as well, to keep people safe. I just have a number of updates, and then I'm going to hand it over to Director Bond and the Director of Emergency Operations, Rick Fontana, in just a moment. Hospitalizations, 360 people are currently hospitalized in the New Haven, Yale New Haven system here or locally. We've had a lot of challenges around testing. I don't need to tell you that. And have been working very, very hard on our own as a city and also with our regional partners in the state to improve access to testing. A couple of updates. Wren Laboratories, while they reopen their sites today, 60 Sergeant Drive and the New Haven Green in the afternoon, they have limited numbers of tests, and they're limiting it, correct me if I'm wrong, but to 150 in the morning at 60 Sergeant Drive, 150 in the afternoon on the New Haven Green, each day this week. And like pretty much everywhere around the nation, we're very, very much struggling to have enough testing capacity, and Wren has been struggling with that as well. So far, the city of New Haven, since this surge started, we've acquired 16,000 tests on our own. And in addition, the state has provided tests for us as well. We are triaging those tests to prioritize essential workforce and have been working very hard to provide tests to police, fire, 911 call center, New Haven public schools staff, so that symptomatic and people that have been exposed to a known COVID case can get tested so that they can return to work. Because we're very concerned about a workforce shortage for our public safety and essential workers and our teaching staff. As folks may have seen over the weekend, just yesterday, Dr. Tracy, Superintendent Dr. Tracy and her team were out with health department officials. Rick and Director Bond and I also visited the site of King Robinson School to distribute many of these tests to New Haven Public School staff who are symptomatic or exposed to COVID, so that they can get to work. Over 500 school staff today were out, and when you think about that, we have approximately 4,000 staff in our schools. Over 500 were out. In addition, 52 bus drivers were out. So a lot of people experienced some delays in the morning. Thankfully, First Student was able to get some additional bus drivers to help ameliorate that issue. But that was and continues to be a real challenge. We anticipate this continuing to be a challenge for the rest of the week. A large portion of the tests that we have received from the state, we are working to make available to New Haven Public Schools students that are symptomatic or have been exposed to COVID. And it's very important that I keep saying symptomatic or have been exposed to COVID, because again, we need to triage our tests. We don't have enough so that everyone can get tested, or people that may be concerned that they interacted with some other people, but they weren't people that had COVID. We don't have enough tests for those folks to get tested, so we're trying to make sure that we prioritize New Haven Public School staff, essential workers, and students that have symptoms or a known COVID exposure. With the availability of testing for students in that category, we're working with New Haven Public Schools and through the school nurses, and we will communicate how families will be able to have access to those tests shortly. We're not sure if we're going to be able to activate this tomorrow or the next day, but we're working very hard on that. The only other information I have is that we have acquired an abundance of N95 masks. I'm noticing, just as I go about, a slow transition of people from the old class style to the N95. I would encourage everyone to do that as much as possible. Your protection is significantly greater. See some folks here, you're welcome to grab one if you want. It's very, very important that we distribute these, and thankfully, because of the state, we have a ton of these masks that we'd like to get out to the community. Finally, wouldn't be a COVID press conference if I didn't encourage people to get vaccinated, get your booster. New Haven is up to 74.2% of our residents have received the first vaccine dose. 64.8% have received both. We do not yet have booster numbers from the state. At some point we'll get those, I'm sure. But very, very important that people get vaccinated. And kids 12 to 15 are now authorized to have the booster shot from Pfizer. Director Bond.
Sure. So good afternoon. As the mayor just notified each of you, we are closely monitoring the surge of cases with Omicron, which accounts for 59% of the cases in the United States. We are seeing and anticipating that the Delta variant will soon, between the next 5 to 10 days, no longer be a variant of concern. It's now Omicron that we are concerned about. It's really highly contagious. It is important that the community continue to be vigilant as we get through this surge of cases. If you have any type of symptoms that even simulates any level of allergies or a cold, we're asking individuals to please stay home, get access to testing, preferably rapid testing. We know that right now PCR testing is a challenge for us in the city. We do want to make a disclaimer that the city of New Haven does not have a testing site. Rather, we support testing sites throughout the city. In particular, the saliva testing site is a Department of Public Health state testing site that we helped facilitate to ramp up so that we can have access to testing. Even with that, there is a shortage. We continue to work with the state. Rick Fontana are in communication daily to ensure that we're looking at other avenues. As the mayor mentioned, rapid tests, because of limited supply, has been prioritized to ensure that we're looking at different mechanisms of high-risk community members and our residents to be able to have access to testing. We also prioritize it for our workforce so that we can remain open as a municipality, so that we can continue to serve the public as we need to do so for different services. We are asking individuals, if you have not been vaccinated, get vaccinated or get boosted. Our health department has evening clinics as well as Griffin Hospital offering Saturday and Sunday clinics. And so we want to make sure that we emphasize, again, if you have not been vaccinated, we see that most of our cases that are hospitalized, having an over 100% increase of hospitalization is alarming. And it is because individuals are not vaccinated. And so that is evidence. And so we want to make sure that you understand the risk that you're taking when you choose not to get vaccinated. This Omicron variant, unfortunately, is impacting every single age group and everyone across the city. So this is community-wide spread. And so this is an urgent message. And I ask the community to step up and continue to work together so that we can get through this surge in the next 4 to 6 weeks. And with that, I'll turn it over to Rick Fontana to talk a little bit about our distribution plan that we have put forth for the city.
Thank you, Director Bond. Thanks, Mayor Boer. Excuse me, Mayor Elicker. Boer was a long-time mayor in West Haven. I forgot though. So sorry about that.
We're close to West Haven.
But anyways, first of all, I want to acknowledge the team here. This has been a weekend and before of a lot of work, trying to keep residents safe, trying to keep our critical workforce safe. I could tell you that just alone this morning, right here out of this building, we've distributed 5,500 COVID quick tests. 5,500. Also, 6,295 masks were distributed here. Team effort, everybody working in collaboration with one another. This is a little bit different. This is a huge challenge for us because our first responder community, our fire department, police department, paramedics and EMTs, we're at a very difficult crossroad here. And we've got to keep those people working. So we are working to ensure that they stay working, that we get tests to our critical staff. We reached out this morning with our Board of Alders. Our 30 Board of Alders were here picking up masks, picking up test kits, getting them into their wards. We had our vulnerable populations, our elderly services, homeless, undocumented individuals, again, and a lot of the private schools we have 48 schools, but we also have a lot of private schools. So they're all coming here. We're doing our best to get everything out as quickly as we can, but this is really going to be a kind of a marathon. We don't expect this to end this week. We are looking at a 2 or 3 week span. So a lot of testing will continue to go on. I know that everyone is concerned with the challenge of getting PCR testing, and that's going to continue to be a challenge, but we're going to do everything we can. We expect to get more COVID quick tests. We just took a shipment of 40,000 N95 masks, 40,000. We want to get those out. That came from the state of Connecticut. We've been working in very close collaboration with the state. They've provided a lot of the equipment that we have to get out. But again, we're going to continue working. This is really, I use this term all the time, but this is really an all hands-on effort by the city of New Haven, many departments. This is a team that's working hard to keep every person that either comes to the city, is a resident here, a visitor, as safe as we can with all of the resources that we're trying to put out. So I'll turn it back over to Mayor Elicker.
Any questions?
Could you repeat how many individual tests does the city currently have or start distributing today? You mentioned 16,000 that the city got, but then another amount from the state.
9,000.
How many are you working with?
Yeah.
And then who is eligible to receive these? I think it's the general public can't just show up here.
Correct.
Maybe repeat who is eligible.
Correct. So we have received, from the state of Connecticut, we've received 9,000 kits. Those are being distributed to those vulnerable groups that we just talked about. Also, school children, also the Board of Alders to get out into their wards and into their areas, again, directly. We expect another shipment. That was a partial shipment from the state of Connecticut. We expect another shipment. We don't have that. We have not confirmed a time or date, but we expect that at some point. Also, the city of New Haven, we're working hard on our own to secure as many tests as we can. So we'll continue to do that. And again, our goal is we've got to keep our critical workforce working.
That's for 9,000 plus 16,000? Is that?
So 9,000, and those are test kits.
Yes, 9,000 test kits equals 18,000 tests.
And then I've seen a couple alders come by taking these little boxes. I mean, how many boxes does each person get?
Yes, so we're giving to each alder in each of their wards will get a total of 60 kits. So that's 120 tests. Each of these boxes have 6 kits in them, and each kit has 2 tests.
And you've mentioned the number of school staff and bus drivers that were out today. Do you have numbers for police officers, firefighters who were out today because of COVID? Is that something you're
Is Virginia still here?
signed up?
Do you know? We can get them to you. We were at like 18%, but we can confirm.
And do you have students? You mentioned school staff and bus drivers. Did you know how
I
many
don't
students?
have those stats. We get.
And then my last question is, what is the city's policy for how long employees who test positive have to quarantine? Just 5 days?
Yeah,
7 days?
so one of the things that we changed as well in the last couple of days quickly is making sure that we modified our protocols and procedures for isolation and quarantine of employees. So we are following the newly revised guidance, which is the 5 days for those that test positive, and then as long as they're not symptomatic, can return with the additional 5 days. We also instituted an N95 workplace mask use, whether you're indoors or in the field.
So I know that there were a bunch, Mayor Elicker, this was for you. You talked about, kind of the school delays and issues this morning, that are COVID related. For parents watching, what can they expect this week and the days to come?
I think it's been very challenging on our school staff and on the parents. And I think that it's important to underscore that this is not going to end quickly. Mm-hmm. However, everything that we have seen is that this surge is going to last maybe 3 weeks, we're hoping, and then it will drop down precipitously if it matches what happened in, for example, South Africa. Mm-hmm. I would anticipate that parents should be prepared for the possibility that their student may need to go remote on individual bases if there are an outbreak in a classroom, for example. we were able to today minimize major disruptions to in-person learning because Dr. Tracy worked to identify substitutes, worked to respond to a lot of the shortages in staffing to ensure that we could continue in-person learning. I think we're taking it day by day. I would anticipate transportation issues continuing to occur over the next week, potentially next several weeks. The silver lining is that we will shortly be able to provide test kits to students that are symptomatic or exposed to COVID. We're working on test to stay, but at the moment we don't have enough tests available to implement that program. And so as the number of tests increase, we also hope to be able to implement sooner than later the test to stay program, which will allow children that are asymptomatic but have potentially been exposed to remain in school as long as they continue to test. So we're asking families to be patient. Everywhere around the nation, people are experiencing this. It's a really, really tough time, and it's very inconvenient, but we're doing our best to make sure that people are safe and that we continue to operate the city in a way that, that helps people live productive lives.
Just to clarify something about the number of test kits, the release that went out yesterday said there were 4,500 kits from the state. Have there since been?
I'm not sure where that information came from,
Yeah, I don't
but
know.
the state did provide us with 9,000 kits, and that totals 18,000 tests.
I think there's probably confusion about 2 per kit versus how, I mean, we're talking about this here too, right? It's confusing
Yeah.
if it's tests or it's kits. Which is,
Are you looking to distribute the masks to the general public?
So we will actually be coordinating with the distribution of kits, again, the COVID test kits and the masks together, not just one, because we literally just got, we were down to 3,000. We just took on 40,000, so we'll be working on a distribution plan shortly. But again, our goal is we've been getting them out into the community through all of our other avenues, through, as I said, our Board of Alders, our groups of elderly, our housing authority, you know, all of the folks that are out in all of those communities, that, especially the vulnerable. That's where we're trying to minimize that as we speak. And moving on, we'll be looking at distributing masks, and as soon as we get the kits, to the general public with a mass distribution. We just don't have that date or time because we're waiting on additional supplies.
So if the second set is not of test comes in from the state, the general public might be able to get
That-
access to them?
That would be one of our goals, yes.
With the 500 absences from schools, were there any classes that had to go remote today, or was it fully in person across?
my understanding is no, but I wanted, before you report that, I want to double check with Dr. Tracy.
Mayor, do you plan on implementing a booster mandate for city employees?
At some point, yes. I think that we're evaluating when that is possible to occur.
And it
But yeah.
said for, I guess, a couple weeks or months, however long boosters have been available, that you're not getting that info from the state. I mean, how important is it to know how many New Haveners are boosted?
I think
Right now,
No,
that-
I think it's very. What's that?
So-
It is available.
So the data is going to soon be available, and so we'll be able to start reporting that. It did take some time to build that infrastructure, so I think once we have that data available, we will share that data certainly.
Well, so I think we're talking about different things. So the state provides community-wide information on first dose, second dose, and boosters.
But not
Separately, we monitor city staff, first dose, second dose booster, right? We are building in our own capacity to monitor who and city staff have had boosters in preparation for an interpretation that all city staff, in order to be fully vaccinated, need a booster as well. Separately, the state, as they have monitored all along the first, second dose vaccinations, are working to have information about boosters available, but they have not yet been able to do so. I understand there's some challenges with the reporting where in some cases it is hard to identify what is a first dose versus a booster. And so the state's working through their data to make sure that they can provide accurate information to municipalities as far as how many people in the community have gotten boosters. that information is hugely important, in particular, given the fact that Omicron, if you're boosted, is way less likely to impact you from a health perspective. And I think that the whole nation is going in a direction sooner than later where fully vaccinated doesn't just mean you have 2 shots. Does that make sense? Okay. Other questions? Okay. Thanks, everybody.